Well, these are unsettling times, but healthcare providers have a very important message. Don't ignore serious health issues and don't let fear of COVID-19 keep you from going to the emergency room. I spoke with cardiologist Dr. Anthony Hart from St. Luke's Mid-America Heart Institute about what they are doing to stop this alarming trend. Doc, for the last several months, all we've heard about on TV news is COVID-19, but I know you're here today to talk a little bit more about another serious health issue that's really been impacted by the virus. What's that?
Well, we know that heart attack, stroke, and other life-threatening illnesses haven't stopped during this pandemic. But when we look back across our own experience since the start of it, we've seen a 40% decrease in the number of admissions for heart attack. Now, the only explanation for this is that people are afraid to come in for medical attention due to the pandemic. And that's worrisome since getting timely care is critical. You'll get better faster and limit damage to your long-term health by doing so.
What safety measures has St. Luke's put into place to ensure patients and staff are safe?
So all patients that come to the ED are screened before to identify possible COVID patients from all others before they even enter the building. Those that are suspected or confirmed to have COVID are cared for in special units that are kept away from non-COVID patients. We also have in-house testing with fast turnaround time to know which patients are COVID positive. We've also canceled all elective procedures to focus on patients with COVID, as well as those that don't have it that have urgent or emergent medical problems. So far, we've been very successful, and we're starting to open back up our clinics and starting to do elective procedures. And finally, we've been very active in research and are leading a global trial to evaluate different therapies for the treatment of the virus.
If patients are having symptoms of an ailment, but they're not sure if they should go directly to the ER, is there a step in between they can take first?
Well, you can call your doctor if you have concerns. Many practices, including ours, have transitioned over to virtual visits, which can be done via phone or video. We also have an app called St. Luke's 24/7 that gives you access to a doctor or nurse practitioner at any time. These are not really to be used for emergency conditions, though. If you're having symptoms of a heart attack or a stroke, you should call 911.
And let's talk a little bit about those symptoms. What are some of those that if people experience, they shouldn't wait and they should go right to the ER?
So heart attack symptoms include chest discomfort in the center of the chest, lasting more than a few minutes. Can also include pain or discomfort that goes to the arms, the back, the neck, or the jaw, and can be associated with difficulty breathing. Stroke symptoms include numbness, weakness, or loss of movement in the face, arm, or leg, particularly when this affects one side. We can see patients with confusion, trouble speaking or understanding, as well as loss of balance.
Well, very important information and good information on the symptoms there from Dr. Hart. If you would like to learn more, visit stlukeskc.org. And we're back right after this.